Hello and welcome to New Mouths Podcast. I'm Sarah, and every week we'll journey together through the intricate world of dentistry. From dispelling myths to exploring the latest in oral health, we've got a packed show for everyone. Ready to dive in? Let's go! Hello, listeners, and welcome back to New Mouths Podcast, where we dive into all things related to oral health. Today, we're unpacking a very important topic, the unique dental health concerns that women face. Joining us is Jake, who has extensive knowledge in oral health care. Welcome, Jake. Can you tell us a bit about why dental health is particularly important for women?
Thanks for having me, Sarah. Absolutely, women have certain periods in their lives, such as puberty, pregnancy, and menopause, that bring about hormonal changes affecting not just their overall health, but their oral health as well.
Interesting. Let's dive in a bit deeper. Could you explain some of the common oral health concerns that are specific to women?
Sure. For starters, conditions like osteoporosis, which make bones brittle, are more commonly seen in women as they age. This can correlate with periodontal disease and even lead to tooth loss. Then we have eating disorders, which are unfortunately more prevalent among women and can cause serious dental issues, including enamel erosion from repeated vomiting.
That sounds quite concerning. Are there other disorders that disproportionately affect women?
Yes. Temporomandibular disorders, or TMDs, which affect the jaw, tend to be more common in women. And another significant one is Sjogren's syndrome, an immune disorder that leads to a dry mouth, increasing the risk for tooth decay and oral thrush.
It seems like women have quite a lot to look out for. Do socioeconomic factors come into play as well?
They do, Sarah. Women from lower-income households or those without insurance are less likely to receive the necessary dental care. Plus, women are also, unfortunately, more often victims of violence, which can result in dental injuries. These are critical factors that can influence a woman's access to dental care and their overall oral health.
Now, could you elaborate on how hormonal events like pregnancy and menopause impact oral health specifically?
Hormonal surges during puberty can lead to greater bacteria growth and potentially gum disease. During pregnancy, there's not only an increased risk for gingivitis, but also morning sickness can cause tooth erosion. And as for menopause, many women experience dry mouth, discomfort, and an uptick in periodontal issues due to the drop in hormones.
What about birth control? Does that affect dental health too?
Yes, it can. Women on oral contraceptives have shown higher instances of inflammation in the gums and periodontal issues, which can increase the risk for more significant dental problems.
With thyroid disease also being more common in women, does that play a role in all this?
It does. Thyroid disease can lead to increased gum bleeding and a higher susceptibility to infections, so it's definitely something to keep an eye on in relation to oral health.
Given all these factors, what would you recommend for the best dental health routine for women?
Well, the basics are brushing twice a day with fluoride toothpaste, flossing daily, and regular dentist visits. During pregnancy or times of hormonal change, women should be even more vigilant. A nutritious diet and limiting sugary drinks are also key. And of course, quitting smoking if that's a habit.
When should a woman specifically seek out a dentist?
Regular checkups are a must, but if there are any changes with your hormones or you become pregnant, schedule a visit. Also, keep an eye out for symptoms like swollen gums, ulcers, jaw pain, sensitivity, loose teeth, or persistent bad breath. These are all signs you should see your dentist.
That's pretty comprehensive advice, Jake. Before we wrap up, can you summarize why it's crucial for women to stay on top of their oral health?
Sure, Sarah. Women face unique health challenges, and several of them can impact dental health. Hormonal fluctuations, physiological changes, and even external factors like violence can play significant roles. Good oral hygiene isn't just about a pretty smile. It's integral to a woman's overall well-being, and staying diligent can prevent a multitude of health issues down the line.
Thank you, Jake, for shedding light on women's oral health today. Listeners, that's all the time we have. But remember what Jake said. Keep up with your oral hygiene and don't hesitate to reach out to your dentist with any concerns. Stay tuned to New Mouths Podcast for more insights into attaining and maintaining good oral health. That's all for today on New Mouths Podcast. I'm Sarah, and it's been a pleasure sharing with you. Always remember, the foundation of a great day starts with a smile. Join us again next week for more enlightening discussions. Until then, keep those smiles radiant.